Thank you, Mr. Speaker. I would have if I was on that side. Honorable Siraj, I would have if I was on that side. Because that's where it's coming from. Mr. Speaker, I rise to make my contribution on the Nurses and Midwives Bill 2022, Bill number 6 of 2022. Permit me to utilize a few minutes to make a few statements in response to some of the remarks mentioned before me. I want to first of all, Mr. Speaker, start by saluting the nurses across our country who have worked diligently, professionally, and had made all sacrifices in the well-being of the health of this nation. And so we say thank you. Mr. Speaker, it was the Honorable, most experienced, learned Attorney General and other colleagues who from time to time mention and keep saying that the work of Parliament in 2019 was illegal and not legitimate. But sir, for 12 months of 2019, the very learned members of the PPC collected the parliamentary salaries, and these included the Honorable Bishop Edgell, the Honorable Gail Teixeira, the Honorable Dharmalal, and the Attorney General, the Honorable Anil Nandal. I specifically call these names because these are the most seasoned politicians in Guyana, and they would not come here to say we would do otherwise. They criticize and yet do the same thing. So I'm wondering, if you're talking about correcting something, I dare the honorable members of the PPC that collected the parliamentary salaries in 2019, if you may, return all to the consolidated fund. And then the people of Guyana will respect you when you speak about upholding the constitutional mandate of this country. Honorable Mr. Speaker, the Honorable Jennifer Westford spoke of the necessity for training of nurses. Mr. Speaker, it is under this very administration that the Linden Nursing School was shut down, placing majority of hinterland students in jeopardy. I call on this administration, if you are serious about necessity for training and nurses' professional development, reopen the Linden Nursing School and let's get nursing back to the business it was. Mr. Speaker, 21st century has presented several challenges to those responsible for training, development, and management of human resources for health. There is need to strengthen the quality of training, ensure the acquisition of job skills that facilitate a comprehensive response to the needs of users of health services, and improve the equitable distribution of these clinical resources. I have no doubt that this very bill before us seeks to do likewise. Mr. Speaker, it was my colleague, the Honorable Valda Lawrence, while she was the Minister of Public Health, vows to draft a policy which will tremendously benefit the nursing sector. Consequently, the Nurses and Midwives Amendment Bill was presented by the Honorable Member in 2018 and subsequently passed and accented to in 2019. This bill then seeks to empower the Nurses and Midwives Council to enroll, register, certified, and licensed nursing personnel, among other things. Mr. Speaker, the then minister said, and I quote, "The bill will also empower the council to take disciplinary actions against nursing personnel for breach of established standards of professional conduct and provide for the establishment of a discipline committee. I am sure that the present administration, well, I hope that the present administration has similar vision. And if they do, I want to say thank you for following in the step of the Honorable Valda Lawrence. The minister further added that the amendment comes with great commitment by the Ministry of Public Health to improve the welfare and well-being of every nurse and midwife countrywide, strengthening the healthcare delivery system. Furthermore, the then minister said, for years, the exercise for nurses to seek specialization within the nursing sector was cut, but with the passage of the bill, it has finally come to an end. Mr. Speaker, I was sitting there waiting for the Honorable Attorney General to at least go through some of the essential clauses of this bill so as to explain to new parliamentarians like myself how it will impact the nurses in Guyana. But the Honorable Attorney General resorted to preamble of a political campaign speech that I have so grown accustomed to in this parliament. Mr. Speaker, while we support this bill, we also call on the government to adequately train medical personnel so as to reduce the pain many mothers go through at some of our hospitals. Mr. Speaker, quality of training must be improved and professionalized. Systems must be implemented for nurses and midwives to improve on their daily tasks. We must seek to upgrade the nurses and to identify failures largely due to poorly equipped public medical institutions. Mr. Speaker, we must seek to remove any glaring deficiencies in the system and set into motion a program to strengthen our healthcare delivery. Mr. Speaker, in 2019, Dr. LaFleur remarked that the ultimate goal of regulations regarding the nursing profession is to protect the public from an unfit person performing the duties of a nurse or midwife. She further posited that the regulations refer to laws that define nursing practice. So it actually defines nursing practice and disciplinary measures. I want you to also know that nursing is regulated because it is one of the health professions that pose a risk of harm to the public if it is not practiced by someone who is prepared or competent. While this was a good observation, in 2022, Mr. Speaker, the people of the hinterland regions seem to be returning to being victims of poor healthcare services. Mr. Speaker, why only one midwife should be nominated to sit on the council when midwifery is a specialty and maternal deaths and misconduct have wreaked havoc over the public healthcare system? There is also a large migration of midwives due to a series of issues, including poor representation and recognition across the board. Over the years, we have witnessed a series of maternal deaths, and most recently at the New Amsterdam Hospital, as they have made headlines over the last few months. Mr. Speaker, in the interest of this, addressing these issues, it would be good to increase the midwives to 2 on the council, in addition to those mentioned in clause 6J under section 2 of this bill. Mr. Speaker, I wish to ask the Honorable Minister of Health, what about representation for the community health workers? How do you guarantee protection of these many community health, and even doctors in the most extreme circumstances without a representative body. These measures are these persons are the backbone of many health facilities across all hinterland villages in Guyana. And I know that many of my colleagues in the government side do know, is aware, and will not try to say that these things are not happening. The Honorable Colin Crowell, who traversed Region 1 quite a lot, would agree with me that community health workers are the ones who carry the healthcare system in those villages. Mr. Speaker, I wish to quote the Paho Dabecho report titled Human Resources for Health, North Migration in Guyana. And I quote, "The health system has been adversely affected by continuing political conflicts, violence, poverty, inequity, and migration of qualified professionals. Lack of investment in human resource policies, low motivation, absenteeism, difficulties to retain station staff in remote areas have resulted in poor distribution and inequalities in healthcare provision." End of quote. This, Mr. Speaker, is what government must seek to address, coupled with legislative reforms. Mr. Speaker, Section 5 of this bill seeks to reduce an all-important scope of responsibilities of the Nursing Council. In the UK, Mr. Speaker, the Nursing Council makes provision that educational institutions meet standards for nursing education and that the Council sets, but they seem not to be involved in composing the curriculum and regulating exams. All of these are in this current act, while the new bill proposed seek to reduce that all-important responsibilities. I wish for the Honorable Minister to give clarity on the reasons for such and how the standards will be set and who then will be responsible. I would say, Mr. Speaker, that we must fight for standards in Guyana as it relates to this all-important health issue. And simply bringing a legislation all because you felt it was not properly done is not the important thing here. The important thing is for us to work together with our nurses, with our midwives, with our healthcare professionals to ensure that they are adequately represented and they receive the best that they deserve. Mr. Speaker, this bill, similar in nature to the 2019 bill, I hope will be very significant in its provision of modern legislative framework and effective management of the nursing profession in a developing country like ours. While I want to believe that this is the intention of the present administration, this bill is tabled at a time when nurses, especially those at the Linden Hospital complex, are struggling through actions largely created by an incompetent leadership. And so if we are competent, willing, and effectively seeking to upgrade the professional nursing system, then we must get rid of unprofessional leaders within the system. And until we do such, then the people of Guyana will respect the government and hold you responsible. We cannot speak to strengthening and modernizing the healthcare sector through capacity building and legislative reforms while ignoring the abuse of power by one or two persons who are obviously power drunk. Mr. Speaker, all nurses and midwives believe that a much needed hike in their salaries must support the new measures. Both categories of health workers have been pursuing higher learning but are not financially rewarded by the public service. Consequently, many have opted for careers in the private sector or bolted for jobs overseas. For example, at one time, Guyana only had one psychiatric nurse remaining in the local healthcare sector. One, Mr. Speaker, one for our entire country. Mr. Speaker, we cannot stress legislative reform, and I keep repeating this over and over, and not seek to address the concern by nurses that a lack of consideration shown by the authorities for their welfare, that their non-involvement in decision-making affecting their professional life is pervasive throughout the healthcare system, and that there is no transparency in such decision-making. This was the vision of the APNU-AFC government while in government, and I'm sure this bill will build on that legacy left by the competent Honorable Valda Lawrence and the Honorable Dr. Karen Cummins, and by extension, the coalition. Mr. Speaker, notwithstanding all measures I have elaborated on, which are anticipated with the passage of this new bill, all healthcare professionals look forward to greater professionalism, representation, and of course, remuneration packages for their sacrifices. Mr. Speaker, in closing, again, I wish to thank all our healthcare professionals, especially our nurses, who continue, and even as we speak, we are not back to normal. We salute you, and we look forward to working with them in bringing a much modernized representation through this legislative reform. And I thank you, Mr. Speaker.